But joining me now is the Director General of Health, Ashley Bloomfield. Good evening. 150 tests from Logan Park High School have come back negative. That must be a relief for you.
Well, kia ora, Lisa. Yes, it is a relief, and I think it's reassuring for both those children and their families and the wider community, but it's also a really good finding for our overall response, because what it suggests is that having done this large group of tests in this community, there are no other positive tests, and it confirms, as we thought, that the transmission was the fact that the father had travelled overseas, and then inside the family setting there had been transmission to the son, and it's really good to get that reassurance.
Let's talk about the restrictions that came in today on gatherings. 100 people is the number that you can have in an indoor gathering. What makes that the sweet spot?
Well, in a sense, it's a number, and it's somewhat arbitrary, but it does give us something to aim for, everybody something to aim for, while still allowing reasonable-sized gatherings. And this is a number that a number of countries have used. Most who have implemented this sort of measure, it's been further down the track. So we're going earlier than, say, Australia or the UK at a similar point in time. And we think it's worth doing that now and working with that small number.
Have you gone with it now because of the jump in cases over the last sort of 4 days?
We're going with it now to help prevent and head off wider community transmission. So all those cases to date, including the 8 that we announced today, have all been associated with overseas travel, with people coming back from overseas. And so still no evidence from our positive tests of any community transmission. Likewise, the 150 negative tests amongst the students in Dunedin helps confirm that, at least in that community. But what we're again trying to do is get ahead of the curve, and this is one of our key steps as well. So it's an important action at this point.
As you mentioned, those people who have been confirmed today with COVID-19, all travellers returning from overseas, there's been a lot of discussion about what's been described as slackness at the borders. Travellers not actually being directly spoken to, no public service announcement on flights. Are you satisfied with what's going on at the border? Could we do better, and how?
Well, I am satisfied, and one of the things we've done just to check that is had a look at it again today. We look at it regularly, and look, there is a really clear process in place, including people required to fill out a card. They have to hand it in. That has to be signed off before they can even go through immigration. There are announcements, there are signs everywhere, and it's very clear to anyone coming into the country there is a requirement to self-isolate.
So do you think passengers
have any symptoms...
Do you think passengers are overreacting, or...?
Well, every now and then, right through the last, 60 days, there's been someone who said, well, we expected this, but we didn't see it. I know that because I've had colleagues, my colleague who's the head of customs was up there today. In fact, as she walked across from the domestic terminal to the international terminal, she asked every person who went past her and every person in the terminal if they knew they were to go into self-isolation and what that was, what was required of them, and they all to a person knew exactly what was expected.
So in terms of the case numbers, we're up to 28 now. What are you anticipating in terms of the trajectory over the next few weeks?
Well, what we are anticipating is that we will keep finding cases in people who have come back from overseas, and we want to find them. We want to find them early in their sort of tenure back in New Zealand, so we can do the self-isolation. So we expect further cases. We're doing much more testing now since these new restrictions came into place, and because of there being more areas overseas where people are travelling back from. So if I look at the 8 today, we've got people who have come back from London, from the US, from France, from Cairo. And so we will expect to get more cases. And what we're really alert for, and our wider testing will find this, is if we have any community transmission, and then we know to ramp up the response even more strongly.
But how many are you expecting? What is modelling telling you?
Well, the modelling is only good insofar it tells you what you do if you don't do anything or if you do certain things. What we've been trying to do, of course, is get ahead of the curve. And as I've said the last couple of days, we're thinking, what is it we should be doing in 2 weeks' time to head off a rapid increase? And then we do that today. And I think what you've seen today is that further restriction on indoor gatherings down to 100 people. So we've seen new cases yesterday, of course, and then 8 further cases today, and these are about the numbers we would expect to see, but we will hope as the number of people coming into the country declines, which it is, that those numbers will level off.
But can you share with us what your modelling has told you about what we can expect in terms of peak numbers of cases? What are we talking about ballpark here?
So we've got a final paper with some modelling in it, and it's going to be released publicly. I think that's tomorrow. But what I've been describing it as is the modelling tells you what would happen if you do nothing, and I've talked about that as an Aoraki, Mount Cook. Then we try to flatten it down to a Mount Marahoe, but what's clear now is that even that is too high. So the actions we are taking now is to try and keep our peak or our peaks below the level of the capacity of our healthcare system, and that's why you'll see all these very stringent and quite significant actions coming into play.
So what is the capacity of our healthcare system? What is the capacity of our healthcare system then that you're trying to keep under? Give me some raw numbers here. What is the number of patients that you could cope with COVID-19?
Well, I don't have a number on the number of patients, because what we also need to remember is that the healthcare system also needs to keep delivering care for New Zealanders with other health conditions. So what we're trying to do is, in effect, minimise the impact of COVID-19 on our healthcare system. So far, of our 28 cases, only 3 have required hospital care. The fourth one today, one of the people is going for hospital care, but the others are all now out of hospital. So what we're trying to do is minimise the impact on our hospital system, and that's where our actions are focused.
So that modelling you're talking about, what are the numbers it's telling you to expect?
So I don't have the numbers directly to hand. And again, what we're doing is looking at one of the most useful papers, and I talked about this in the stand-up today, came out from Imperial College London a few days ago, and that looks at what would happen in any country if you don't implement measures, and then how, if you implement measures, you can actually keep the numbers down, and that's what we're aiming to do.
And I understand that, because you're aiming to get numbers below what your capacity is in hospital. So how many ICU beds do we have available to us in the public system right now?
Well, at the moment, we've got around 170 fully staffed ICU beds. We also have high dependency unit beds. We have a large number of other beds that could be repurposed for ICU level care, particularly ventilating.
So how many would you have available to you in total?
I have a spreadsheet, but unfortunately I don't have it in front of me right now. But we've actually, if you look on our website, we've had some numbers up there for some time, but we're just re-looking at those to see how many ventilators we've got. We're also sweeping through.
How many do you have ventilators-wise?
Again, I don't have those numbers in front of me.
I suppose what I'm asking you is, given what you know about what resources we have in our hospital system, are you going to have enough ventilators and beds, high dependency or ICU beds, to deal with the numbers you're anticipating that will come through and need hospital care? Do we have enough to go round, or will you have to ration that care?
What we're aiming to do is to avoid getting into that situation. And that's why you saw last weekend when the announcements were made about the significant border restrictions, people working in the healthcare system and public health academics welcome those measures because they are specifically designed to actually reduce the impact on our healthcare system to ensure that the impact of COVID-19 is within the scope of what our system can cope with, and that's why we're acting early and fast.
Can you tell me, how much does it cost for a COVID-19 test?
I don't know the exact cost of the test, but what I can say, of course, is in the package that the government announced earlier this week, which included funding for the healthcare system, that is to cover the cost of both the test and the testing. So people won't need to pay if they go and get a test at the GP. So there's no barrier to testing. No,
but I'm just interested in terms of the overall cost. So you can't give me just a ballpark figure for what that test costs the government, one test?
To do in the laboratory, no, but I can get that information. It's not a hugely expensive test, but I can get that information.
So how many of those tests do we have left?
We have an ability to do quite a number, and in fact, in the last 2 days, we've seen the numbers increasing.
But that's the numbers you're doing, isn't it?
Yes.
So I'm asking about the pool of tests that remain. How many tests unused do you have available to you?
So it's not in terms of an actual test and having a number of tests. It's about the materials you need to do the test, which of course are swabs. You need the machines in your labs and then the reagent for those machines. So, of course, our job is to make sure we've got supplies of all those things to keep the testing going and ensure that we can test the right people.
Are you looking at webcams for doctors to interact with patients that they should potentially be keeping their distances from?
Yes, quite a bit of work going into that actually to help support primary care, in particular, so they can do consultations for people who don't necessarily have COVID-19 but other conditions, so they can do more of those remotely. For example, if we've got older people for whom it's safer to stay at home, and if they've got chronic medical conditions and they need to talk with or get advice from the GP, then to be able to do that remotely is really helpful. So that's one of our work streams we're gearing up as well.
And will they be prioritised to more remote areas, or how will that work?
Oh, it would be anywhere really. And of course, one of the things we're really keen to do is ensure it's not just available in the cities, but it's available in rural areas too.
When do you think you might be ready to roll that out?
Well, it's just one of a number of streams of work. One of the ones we're focused on particularly is our sort of community-based assessment centres, and those are coming online now. One in Christchurch is already underway, and Auckland's going to have at least 5 starting before the end of this week. I think it's actually this weekend, and then they'll be working up further ones for the Auckland metro region as well.
Really appreciate you joining us this evening. Thank you for that. That is the Director General of Health, Ashley Bloomfield.